Polycystic Ovary Syndrome, or PCOS, is a common condition that affects your hormones. It is associated with long-term anovulation or problem of releasing eggs from ovary and excess androgen hormone circulation in blood. In PCOS, women's sex hormone is out of balance, which leads to growth of ovarian cyst. PCOS affects women across various ethnicities, though its prevalence and symptoms can differ. Research indicates that women of South Asian and Middle Eastern descent may experience higher rates of PCOS. The World Health Organization reports that up to 15% of women of reproductive age are affected by this condition. Most diagnoses of PCOS occur in women in their 20s or 30s, often when they are trying to conceive. The risk of developing PCOS is higher for those with obesity or a family history of the condition. Symptoms of PCOS typically begin around the time of a girl's first menstrual period, though they can also develop later after menstruation has started. The symptoms can vary widely among individuals and may change over time, often appearing without a specific cause. We have gathered a comprehensive guide to important indicators and common signs of PCOS which everyone should be aware of. Number 1. Irregular menstrual cycles. Having few menstrual periods or having periods that aren't regular are common signs of PCOS. So is having periods that last for many days or longer than is typical for a period. The lack of regular ovulation means the menstrual cycle is not properly regulated, contributing to the irregularities experienced by women with PCOS. The uterine lining builds up for a longer period of time, so the periods you do get can be heavier than normal. Number 2. Excess hair growth. PCOS causes excessive hair growth, a condition known as hirsutism, in more than 70% women with this condition due to elevated levels of androgens, which are male hormones present in higher than normal amounts in women with PCOS. Androgens, such as testosterone, can stimulate hair follicles to produce more hair in areas typically associated with male pattern hair growth, such as the face, chest, back, and abdomen. The increased androgen levels are a result of the hormonal imbalances caused by PCOS, including insulin resistance and ovarian dysfunction, which further exacerbate the production of these hormones. This excess androgen activity leads to the development of coarse, dark hair in these regions. Number 3. Acne. PCOS can cause acne primarily through elevated levels of androgens. Androgens stimulate the sebaceous or oil glands in the skin to produce more sebum. Excessive sebum can clog pores, providing an environment where acne-causing bacteria can thrive. This combination of increased oil production, clogged pores, and bacterial growth leads to the development of acne, often in areas such as the face, chest, and back. Additionally, the hormonal imbalances associated with PCOS, including insulin resistance, can further exacerbate the severity of acne. Extra androgens can also keep your skin always oily. Number 4. Weight gain. PCOS causes weight gain in 40% to 80% of people through a combination of hormonal imbalances and insulin resistance. Many women with PCOS have insulin resistance, meaning their bodies do not use insulin effectively. This condition leads to higher insulin levels, which can increase fat storage and make weight loss more difficult. Additionally, the hormonal imbalances associated with PCOS, including elevated levels of androgens and cortisol, which is a stress hormone, can contribute to weight gain, particularly around the abdomen. Number 5. Darkening of the skin. PCOS can cause darkening of the skin, a condition known as acanthosis nigricans, primarily due to insulin resistance. Elevated insulin levels can stimulate skin cells to proliferate more rapidly, especially in areas where the skin folds or creases, such as the neck, armpits, groin, and under the breasts. This overgrowth of skin cells results in patches of skin that become thicker, darker, and often have a velvety texture. Number 6. Increased hair fall. PCOS causes hair loss on the scalp, known as androgenic alopecia, through elevated levels of androgens, particularly testosterone. In women with PCOS, the higher androgen levels can cause hair follicles on the scalp to shrink, leading to thinner hair and slower hair growth. Androgenic alopecia typically manifests as diffuse thinning of hair on the crown and top of the head rather than complete baldness. The hormonal imbalances associated with PCOS disrupt the normal hair growth cycle, causing hair to spend less time in the growth phase and more time in the shedding phase, resulting in noticeable hair loss over time. Number 7. Infertility. PCOS is one of the leading causes of infertility. It causes infertility primarily by disrupting the normal ovulation process. Women with PCOS suffers anovulation, where the ovaries do not release an egg during the menstrual cycle. Without ovulation, there is no egg available for fertilization, making conception difficult or impossible. Additionally, the hormonal imbalances can lead to irregular menstrual cycles, further complicating the timing for natural conception. The development of multiple small cysts on the ovaries, characteristic of PCOS, also contributes to these ovulatory issues, resulting in infertility. Number 8. Polycystic ovaries. During a typical menstrual cycle, follicles in the ovaries mature and release an egg during ovulation. However, in PCOS, the hormonal imbalances interfere with the development and release of eggs from the ovaries. The ovulation process is disrupted, and the follicles may not mature properly or release an egg. Instead, these immature follicles accumulate in the ovaries, forming multiple small cysts, which give the condition its name. These cysts are not true cysts, but rather underdeveloped follicles or fluid-filled sacs that have failed to ovulate. This accumulation of immature follicles can be detected via ultrasound and is a characteristic feature of polycystic ovaries. Number 9. Insulin resistance. PCOS causes insulin resistance through a combination of genetic and hormonal factors. Elevated levels of androgens and abdominal fat, common in women with PCOS, interfere with insulin signaling pathways, making cells less responsive to insulin. This results in higher insulin levels as the pancreas compensates, which further exacerbates hormonal imbalances by increasing androgen production. Additionally, low-grade inflammation associated with PCOS can impair insulin action. It's important to consult with a healthcare provider for proper diagnosis and management if you suspect you have PCOS. To conclude, we can say, understanding the reasons behind the symptoms of PCOS helps in recognizing and managing these conditions. If you're experiencing any combination of these symptoms, it is essential to consult a healthcare professional for proper diagnosis and treatment. Early intervention can significantly improve quality of life and prevent complications associated with PCOS. So, when was the last time you tested your hormone level for PCOS? Subscribe and stay with us for a continuous stream of expert advice to elevate your daily living and embark on a path to a healthier you.